Hi, Dr. Abhishek Yadav. It's a great news for us that you have got first rank in Common Merit List and fifth
Thank you, sir.
rank in AIIMS list. So we all are very proud of you with your achievements. So share us about yourself. Like where do you belong to? Where are you from? How your journey started? So we all are very eager to know about it.
Thank you, sir. Sir, myself, Dr. Abhishek Yadav. So, I belong to Ajmer, Rajasthan, and I did my MBBS from SMS Medical College, Jaipur, and MD Medicine from SMS Medical College, Jaipur. And in this July session 2022 in INISS, I secured CML rank 1 and AIIMS merit list rank 5.
Great. So it's a beautiful rank, dream ranks. So
Yes, sir.
now just elucidate us about how your approach to the studies were. Like when did you pass out your MD? 2021,
Uh,
right?
yes, sir. I passed my MD final exams in 2021.
2021. You hardly had less than 6 months for preparation, I
Yes,
hope.
sir.
So,
Yes.
how did you concise your preparation? Like you have a big Schlesinger, you have a Harrison. So, how did you specifically try to, concise and prepare the entire gamut of topics?
So initially, I was during my MD days, I was much inclined towards gastroenterology because actually LFTs fascinated me, all AST, ALTs, and OTPTs. So I just actually in the MD days only, I much focused much more in the gastro part in Harrison, and I have read it some 2-3 times. After passing my MD exams, when I saw the exam pattern demands much more than that, I shifted towards Schlesinger. And in Schlesinger, I read topics that are being majorly repeated and majorly asked in PT's competitive exams. So I gained the knowledge about these topics through giving tests via DocTutorial app many times. And on in those tests, I got to know what are the focus areas on Schlesinger because Schlesinger it's in itself is a big mammoth book, and I was finding it really difficult to complete the whole book or complete each and every topic before the exam. So I pointed out some topics and read them, made some notes to help me in the preparation of the exam.
Excellent. Okay. So your approach was more like retrospective on questions and get
Yes,
some
sir.
knowledge, and then that topics is
Yes, sir.
covered, isn't it?
So
That was
actually, the more the questions we attempt, we get to cover a lot of the areas of the gastroenterology because there might be some areas might be left, but as much questions we attempt, as much tests we give, those tests, the questions which we did not attempt, they highlight the areas which we have left for now. So I go back to the book and just read them again and made notes
great.
for them.
Good. So retrospective approach, which really
Yes,
helped
sir.
you, and here you're top of the mountain. So
Thank you.
congratulations once again. So
Thank you.
the next question I want to ask you specifically is: now you have told us how to approach from question to concepts.
Yes.
Okay. So that gave you a good rank also. So the next one is like we tend to make mistakes sometimes regularly. So what is a strategy for revision? Sometimes it never completes, right? So how did you plan revision for your topics?
So I especially made flashcards. I
Okay.
some made flashcards that I read some. It took me some 24 hours to read them. Whenever I was traveling to give the exam in the train or bus or wherever, I just read those flashcards because those
Okay.
flashcards had those topics that usually slipped out of my mind. So
Exactly.
I never referred to my notes, never referred to the book the 2-3 days before the exam. I just relied on my flashcards because whenever I was giving tests, I was having difficulty recalling a few facts or few points in the approach or some numerical based questions like what should be the cutoff for GB wall thickness in acute cholecystitis or in case of gallbladder carcinoma. What are the different classification for sphincter of Oddi dysfunction? What should be the numerical value of how many millimeters of mercury pressure is required to diagnose SOT dysfunction? So I just wrote those points like they would just ping that area of my brain that it would get refreshed that okay, I remember the numericals because when you see those flashcards you get a type of confidence that yes, you remember those things.
So you have used a nice concept that 3 to 4 days before the main exam, no learning new stuff, no seeing lot
No,
of words in
nothing, sir.
textbook, not even your own notes. It was
No,
more
sir.
of these specific points where it
Yes,
strengthens your mind, or the mistakes you have committed while solving MCQs. These were the
yes,
things that were actually noted down. So,
yes,
and you are able to go through revise the entire subject in hardly 24 hours also.
yes, yes,
That
sir.
is,
It is possible, sir, because
that's
these
the,
are all, yes, sir, because there are some areas where you are good, and you won't commit a mistake. But there are areas that you tend to make mistakes much a lot, and you are not such confident. In those areas, you need flashcards or just a small notepad which you can flip and flip and flip for the next 6 or 8 hours, and just read those lines and points only.
excellent. That is great, because at one stage of my life, even I was more into noting down the most important stuff and just revise that
Yes,
smallest book possible.
yes,
So that really helped me also. So that's a good take home message for students who are starting off now for the next exams. A really well taken point from you. The next major thing that we as teachers or guys who start preparing questions or teach have noted is there is a major shift from factual questions, which we used to see some years ago, to more case based scenarios of late and approach based questions. Now, what is your take on that? Like, is this trend a healthy trend? And how did you manage your preparation strategy for these kind of evolving questions into an approach to the patient?
yes, sir. In actually, sir, I had experience of giving sir two INIs. It was my second attempt, so I got a fair idea about what the central institutes are trying to see in their candidates. Actually, they are more concerned about whether this person, if called to our casualty by some emergency physician and asked to evaluate the gastrointestinal complaints or whatever, would he be able to arrive at a correct diagnosis and proceed correctly towards the further investigation or management? So whenever we are reading, we should focus on the good approach towards a case diagnosis, like how a patient would present and what the sequence of investigations or management points, where do they intersect, what are the various flow charts in the approach to a patient. They should be correctly remembered, because they are not going to ask you any diagnostic criterias or some cutoffs about any values that above 5 bilirubin you would do this or not. They won't ask you. They just ask you whether you do it or not, whether it is indicated or not, whether you could proceed only towards conservative management or you would go towards surgical management. They are more concerned about that, because
Yeah.
in the due course of time, we would learn in upcoming 3 years or whatever we are spending with them. But they just want to know that we are in the right direction or not in seeing
Okay.
a patient.
Yeah. So what I can tell, what you are trying to tell is, it is decision making which is a
Yes,
major
sir.
cornerstone, and is your decision making an approach towards the patient symptomatology, investigations, and the treatment in the right direction. They're
Yes, sir.
probably not really bothered about whether your diagnosis is right. They would
No,
probably
sir.
bother about if your differentials fine. Are you in the
Yes, sir.
proper direction? Is that what they
Yes,
are
sir.
trying to see?
Yes, sir.
Excellent. So that's a good trend and an evolving trend, which is really healthy. So, how were you able to manage this new scenarios, case-based scenario? Were you going through some USMLE-based questions or review articles or review questions? Like, what really helped you with respect to answering these questions?
So actually, there is a single review book in which the questions are mostly case scenario based. If you attempt that book, you would get such a long questions of cases, and it was so beautifully crafted that you would never forget how to approach a case. If a patient comes on trolley in emergency, the whole presentation is presented so beautifully in that book, and if you attempt that book, it just makes your concepts clear, that what to accept in a patient coming like that or presenting with that case history or investigations. So it won't be a problem if you attempt that. So
Yes.
just listening the review book helped me a lot in clearing that approach dilemma.
So when we read a question, our mind may not pick up the factual stuffs in a question, but when you tell that you are in emergency, somebody has called you, this patient has this, so you would visualize and you would enjoy reading those kind of clinical scenarios, isn't it? And the soft skills of differentiating two close differentials also start, picking up well. So very well taken. So more question solving and case-based scenarios is something which we should concentrate on. That's great. Now, what is your take on preparation for interviews? How do you think the preparation should be? Did our mock interview rounds help you in probably, fine-tuning the entire gamut of things and telling these are the concise stuff which you should probably look into? How did your interview? What do you suggest for preparing for interview? What should be the strategy?
So mock interviews by DocTutorials were very good. So actually, they just briefed us about everything. So you helped us a lot. The case scenarios you put us in forward. You put individual effort in all of us. The all in our group. It was very much helpful, and the spotters actually helped because all the spotters you sent, they were all in the exam in the interview. Whatever the spotters you show, some 20, 30, whatever they were all in the interview. And you correctly guessed it that whatever spotter they would show, they would be related to your case scenario only. So some 2 to 3 spotters were about that case only with that case scenario that we were given.
Oh, that's great. See, last year, last INESS, the question was just case scenario. They just gave 2 long cases for the students. That time I told them, okay, concentrate on statistics, also concentrate on COVID, also concentrate on these spotters. But this time most of it actually helped because those spotters, and now there was a small change in the pattern also. They asked one question and one 2 to 3 spotters was what the feedback I got. So it's always better to stick to our principles and go on systematically rather than just jump to follow the trend of what happened exactly the last time. So that little decision of going through the entire ones and looking at each of our students' approach, how they are thinking, is there a mistake from our side also? Those little things you would start realizing, yes, fine, this is somewhere we should get stronger at. This is an expected question. The approach was very similar to what the actual scenario also happened. So that's really nice of you to put everything in a nutshell, Dr. Abhishek. Good luck with all your endeavors, and we are really happy to be a part of your success story. So we are happy. Join our club and please keep in touch with us. And definitely there will be many followers. So for the next set of students, again, each of your inputs will really play a major role. So definitely keep in touch with us. And last question for you. See, people are really, majority of them, see, not everybody get into INESS. So there are a number of students who want to give a NEET SS because the seats are more. But the preparation strategy should be a little different because it's not gastroenterology which is asked. You have a medical. So what do you think is the strategy which may help these set of students who are now with having just 2 to 3 months of time for the exam and would want to prepare medicine come gastroenterology? How do you suggest them to divide their topics or to approach it?
So as per the recent NEET SS pattern, so I think now the Harrison becomes much more important than Schlesinger in every aspect. Because it's not gonna focus on any particular subject because they would give a fair amount of equal weightage to neurology, rheumatology, cardiology, and everything. So it's more about just reading more and more of the Harrison and making the notes of the important points that might be asked. Focusing on the Harrison might be the only alternative right now because because the last some 3-4 years back also that the same pattern was there in NEET SS, and actually everyone read Harrison only for that also. So no point about thinking about the pattern, but just to focus on what we can do best. It would be really helpful and focus on all the topics possibly.
For NEET SS, focus on all the topics. You can't cover everything, but at least the major ones, and overall we should be knowing, not to go in depth in anything specific.
Yes, sir. No, sir.
Okay. Great, Dr. Abhishek. We are really proud of you. Wish you all the best. Congratulations once again.
Thank you, sir. Thank you.
So keep in touch. Take care. Thank you.